Thank you so much, Amy, and thank you for everybody that's chiming in that you can hear me. All right, this is going smoother than last time already. So welcome to our second coronavirus update. Thank you all so much for joining us. I am going to actually ask Molly if she wants to start us off by just reviewing what it is that we're hoping to do with SASH during this time of COVID and also what our priorities are, and then we'll spend the rest of the call sort of working through all of those.
Super. Thank you, Melissa. I hope you all can hear me. Welcome to the call. Thank you all again for joining us for now our second weekly call. Really appreciate you guys all being here. I'm sure that, like me, last week for you all was pretty unprecedented. Getting used to this kind of new way of operating in what will hopefully be very much an interim situation, but definitely took a lot out of me last week, and I know all of you as well. So thank you all for working so hard, and I just want to remind you all to please take care of yourselves and find time to practice that wellness, those wellness activities that I know you talk to your SASH SASH participants about a lot. Please remember that you'll be the best SASH staff if you are well. So really prioritize your health and wellness. We just wanted to make sure we start off these calls every time with just a reminder of what the administrative team for SASH across the state really has defined as our initial priorities right now while we're dealing with this pandemic. And they're right in front of you, but clearly number one is to prevent the spread of the virus, and really being very focused on that. And I think that's where most of all of our time was spent last week, is to really kind of figuring out what does that mean and how do we operationalize that. And I think that we're really starting to work into this second bullet here, which is getting real about how do we support our SASH participants during this time. What are some of the tools and resources that we can use? We, of course, at the administrative team, are absolutely focused on this third bullet, which is, figuring out how best to help you all do your important work and your direct work as much as you can with your participants. And clearly our fourth bullet is, we're all working for different organizations, but the shared mission we have is the SASH program and the SASH supports that we provide to our participants. So how can we, during this very difficult time when all of our organizations have to make difficult decisions, how can we keep the SASH program as consistent as possible so that it's running well and it's running in a way that makes sense for all of our participants. So just a reminder about that. Thank you again for all that you're doing and being part of this call, and I look forward to hearing some of your questions and ideas today. So Melissa, I'll turn it back over to you.
Great. Thank you so much, Molly. Okay, so with that in mind, we have some information that we want to share with you, some stuff that's happened in the last week, some things that we've gathered, but we want to know what you're hoping to hear from us and make sure that we hit the mark. So now is your chance to chat in any questions or discussion topics that you are hoping that we'll cover today. And if there's any on here that we weren't prepared to talk about, we will certainly do our best to get the information back out to you as soon as we can. So I'm going to give you a second to chat in any questions. Masks. Are masks helpful? Oh, someone's talking about, okay, so we will talk about the mindfulness group in a little bit. We have a slide for that. Some of the questions that we've heard from you all around the state this week have been some things like, question for commodities. Are we still going to have deliveries to our sites if we normally do? Okay. Social distancing. Oh, sorry here. A great webinar this weekend, and they use the term physical distancing in place of social distancing. This way, keeping physical space is emphasized, but maybe we still remember the importance of remaining socially connected. I love that. Thank you, Judy. That is just fantastic. So maybe we should think about changing our language to physical distancing. If you could share that, where you heard it, was it a webinar? Maybe it's something we could all watch. That'd be great. Kat asks if we should connect with the Vermont Food Bank directly for commodities. I do have a bit of an update on that. MJ shared that hers was just delivered. Use and disclosures by mail. We sign after sent back, witness. So we've got a use and disclosure question, commodities, food bank. Do we prefer participants pick up Meals on Wheels from community kitchen, or should I deliver to outside apartments? Okay, so that's a great question. Let's talk about Meals on Wheels delivery. And then, oh, yep, great feedback. Okay, so some of the other things that we heard come in that we are hoping to cover today as well are questions around maintaining social connectedness when we're trying to keep our physical distance, maintaining mental health care, questions about DNRs and COVID-19, as well as advanced directives. We've also had some questions come in around PHL and home computers and new referrals, doing assessments by phone. It's been a really great week for trying to just get into the logistics of how this is actually going to work. So I think that I've got all of has there been any discussion of pulling nurses off to work at a higher level capacity? That's a great question, Melissa, and there has been some questions about that. We can certainly address that. And then Meals on Wheels volunteer that Meals on Wheels are supposed to be left in a bag on their door handle. Okay, so I'm going to move us along, but please continue to chat in your questions. I will do what I did last week as well, which is because the questions, I love that you guys are using the chat, because we have 67 people on the call right now. There's just no way that we can unmute you all and have a productive call. So we're going to keep going through the chats, but if I miss any, I will review the chat log afterwards and make sure that we address any questions that we may have missed. So thank you all for being so connected and using that chat. I wanted to just start off by sharing some of the numbers. This is the update as of yesterday, because they do the update every day at 1. So it looks like in Vermont, we currently have positive tests of 52 individuals, and we unfortunately have had 2 deaths. In Rhode Island, they have had 83 positive, and I'm assuming that because there are no deaths reported, that means that they have not yet had any deaths in Rhode Island. And in Minnesota, there's been 167 cases and 1 death. I will say that as I was looking at this, I noticed that I had pulled the numbers originally on Friday, and then they were obviously useless, so I pulled them again on Monday because there had been such a large increase in each state. But the interesting thing to me was that the number of tests conducted had also been very drastically increased. So I feel like we're seeing the positive tests coming in because we're doing more testing. So in a way, to me, that does actually feel like good news, where the more we test, the more we catch, the more we treat, hopefully the better the outcome. So I wanted to just share that level setting so we all know where we're at right now. And then some updates that have happened just since our call last Monday. The adult days and senior centers closed last week by a mandate of the governor. This is in Vermont, but I think also in Minnesota. I'm not sure if they have closed yet in Rhode Island. But by doing so, that also stopped most of the community meals. Some of the meal sites are offering food delivery or pickup options, and Meals on Wheels is still happening in most of the state of Vermont, as far as I know. There have been some updates to the home and community-based services program. So these are things like Choices for Care, the DS waiver, and the traumatic brain injury waiver. And basically the update there in a nutshell is that they're stopping non-essential visits. So visits by case management are now happening over the phone, but visits by nursing or even some homemaker in some cases are still happening. There have been more drive-through testing options being made available in all 3 states. And the Vermont Food Bank update, so basically what I have been notified is that until further notice, all produce deliveries will become drop and go. So that means that the drivers will deliver the boxes of food and then depart, whereas normally in some cases they would stay and help hand things out. They are not going to be doing that anymore. They will also be sending along bags so that produce can be bagged up and then left outside of apartments. And they're also welcoming feedback. So if anybody has anything with the Vermont Food Bank going on right now and you have an idea of a way that it could work better and more efficiently, please feel free to reach out to the food bank. And then I would just ask for the chat log, is there any updates that I missed or that you know of that you wanted to share? It does look like we have some people chatting in, so I will try to get to those. Kathleen Gamble asked, how many places have people on site in locked offices versus working from home? That's a great question. Maybe people could chat in what they're doing. But Deb said that she's heard from a case manager that those on waivers that have gone to adult day services are being given the opportunity to sign up for home delivered meals in Minnesota. Oh, that's wonderful. And I'm not sure if that's happening in Vermont or Rhode Island, but that's definitely something that we could look into. I appreciate that they recognize there's at least one aspect that they might still be able to help with. We'll have folks on site at least weekly. So April is with Cathedral Square. She mentioned that they're going to try to go in at least once a week to their site. On site to distribute notices. Oh, I'm a SASH coordinator in Northfield. Wow, lots of people. This is awesome. Okay, hold on, sorry. So someone in Northfield is working from a locked building. Milton is on site to distribute notices, change message, work from home the rest of the week. We have weekly folks on site. We have folks on site at least weekly. And again, Nicole's there. It sounds like Nicole might be there in Northfield every day, but working from her locked office. And Kathleen is in her office up in St. Albans, and Samantha Mitchell is a wellness nurse, and she's working from home. And Annie McCormick's doing kind of like a shorter day on site. So she's spending the mornings on site and then the afternoons at home. Fantastic. One of the things that we wanted to share that we did as a result of our call last week was created the COVID-19 individual plan that you'll see on your screen right now. So this was created as a result of the conversation that we had on last week's call. And I would it's on STAR, it's there for you to use, but I would love your feedback. So if any of you have used this and you have feedback, it worked great, I'd like to see this question. Jessie Cudworth said she loves it. Honestly, if you see a question that's missing, if something keeps coming up, and it'd be great if it were just a checkbox on here, please let us know. We are happy to amend this as we go. This was literally our first stab at a document, and not one that we've needed before. So here's hoping that we can adjust it and edit it as we go. I'm going to see if Casey, do you want to talk about the SASH workflow? Or if you want me to, and you can talk about the wellness nurse portion of it, that would be fine. But we have worked on creating sort of an idea about what does this look like now that we maybe aren't in our offices all day, every day.
Hi, Melissa. I'm happy to speak to it. And I did want to add about that, the previous slide on the COVID template it is on STAR now as a document that you can edit and kind of make your own as well. So if there's something you really need specifically, you can add it on there.
Oh, perfect.
Melissa, there's some
Thank
comments
you.
in the chat about the suggestions for the document, and then April had a question.
Okay, great. I'll read through those, Casey, if you want to talk through the workflow, and then we can address those questions after.
Sure. So our immediate priority is checking in on participants by phone to assess their risk, and we talked a lot last week on high, medium, and low risk and how to put people into those categories. We also need to be assessing their current needs and anticipated needs. So somebody may have plenty of groceries right now, but they have no way of getting more. So trying to help folks stay a step ahead of what their needs might be. And I think one of the real priorities for all of us right now is to stay on top of what the what our local community has for services and how to meet our participants' needs with those services. Those are changing. There's a huge amount of volunteer grassroots efforts popping up all over the place, and kind of developing some connections with those groups, thinking about how to protect HIPAA while working with those groups is going to be really, really important in the next week or so. Both the SASH coordinator and the wellness nurse need to stay very connected and find ways to, again, safely and with HIPAA compliance, share information. So needing to know who's called and who's talked to who and having a system for that. And that's going to be, again, very team specific, but come up with a strategy for checking in, who's going to call who's going to follow up, who's going to connect with services. The next one, as far as frequency in check-ins, I think that our high-risk folks are going to, in general, need more frequent check-ins, maybe a weekly check-in. But again, it's specific to the participant. So you may have somebody who's at really high risk and has a lot of medical conditions, maybe they have cancer, maybe they have COPD, but if they have a family member living with them who is taking care of them, you might not need to call every week. And then you may have somebody who's at very low risk but has no social supports and they need a lot more check-ins. So there's no mandated call everybody once a week. Just make sure you're connecting with all your folks at some point and then finding out what they need and how often they want to be checked in with. Melissa, I'm going to let you speak to the use and disclosure update, but let me skip to the assessment piece. We're working hard on a workflow around getting assessments, keeping assessments up to date, getting assessments done over the phone. And so that is going to be able to start. That is not a priority for this week. I don't think that's a priority at any point, but we don't want everybody to be way behind when this all blows over. So for people who we're able to assess over the phone, we do want to start doing that as time allows. And there will be more guidance coming out on exactly what that will look like. Melissa, do you want to speak to the use and disclosures?
Yeah, absolutely. Thank you, Casey. So for use and disclosure updates, what we're suggesting right now is that you mail them out and get them back in. We understand, however, though, that may be a bit cost prohibitive if you have a lot that are due right now. So we are working on some guidance around a way to be able to accept a verbal consent in those cases where you can't get a written consent. And so we will be working on that and getting that out to you as soon as we can. We're hoping that this week we will have some guidance around some procedures and protocols to follow in order to obtain that verbal consent. And then I also do just want to, some questions came in, and I want to just make note of them. So there was a question about essential workers. Would SASH be considered essential workers during lockdown? That's actually a question that we have too, and we're working right now through figuring out if so and what that looks like. So unfortunately, we don't know the answer, but we are working on it. Somebody mentioned that the date of birth should be added to the COVID-19 individual plan. So if we can absolutely do that, that's no problem. And then there was some great conversation too about one area had turned it into a Word doc and was just typing the answers in and saving it. And another person chimed in that there is also a PDF fillable form for that exact reason. So you can do that as well. And then the last question was asking if there's a way to document the COVID-19 plan in PHL, and there is not right now. You can scan it and upload it into PHL if you want to, or you can put in the notes that it's been completed and to check the paper file. So I think I've gotten through most of the questions that have come in right now. Yep, there's a question coming in about sharing info, so we will get to that as well. I'm going to move us on, Casey, to so we created these COVID-19 workflows for SASH coordinators and for wellness nurses. And basically, we were just trying to think about, how do you plan your work when your work looks so different now? And we put together this kind of just bulleted checklist of ideas. take it, leave it, make it your own, whatever you need to do. But this is sort of our thought about, and these hyperlinks, I'm hoping that when we share this with you on STAR, I can actually have hyperlinks that will go right to the Community Healthy Living Plan, that will bring you right to resources on STAR. But basically, if you've been working from home for a week now and you haven't been doing home visits, what should you be doing? And this is some guidance that we've created to just give ideas of things that, maybe you've thought of and you're already working on, and maybe you haven't and you think they're great ideas and you want to work on them. The first and foremost is just the COVID-19 individual checklist. We're really thinking that that's probably the key priority that everyone should be thinking about right now. But then after that, making sure that your data's up to date in PHL, trying to get those assessments done if possible. We are creating some guidance around how to do an assessment over the phone, because that's probably pretty new to most people. So we are trying to come up with some ideas there to help, tips and tricks. One of the things I think that actually is really cool is that you could possibly be on the phone and have PHL open and just document right as you go. So it can reduce some of the duplicative nature of filling out the paper and entering it into PHL. Maybe you want to work on your next SASH class, or you want to consider thinking about your next healthy living plan. I think all of these things are just sort of like a down the road as this goes on and you're looking for things to do. These are some ideas. Obviously the first and foremost right now is trying to connect with your participants and making sure that everybody's okay. And then Casey, did you want to talk a little bit about the ideas for wellness nurses?
Sure, and a lot of these are the same as for coordinators, doing the check-ins, connecting with by phone or email or FaceTime with our participants. Like I mentioned before, we make sure we're connecting with the SASH coordinator, that we're not making too many phone calls to somebody who doesn't necessarily want them. One thing that some panels are doing is having some office hours where you call in office hours for chatting. So it's not necessarily a medical conversation, it's just a conversation. And I think it's important for both the coordinators and the nurses to make sure in these phone calls that we're assessing for symptoms but we're also assessing mental health and how are folks doing, how are you doing with all of this, those kinds of questions, because people just need to vent, and also you need to, with our people being so socially isolated, this is going to be a really challenging time for people. Our nurses can certainly be catching up on data, working on health presentations, and doing more of those. And I put a few classes on here as well, and other ways we can connect online if that's something that you're interested in. And I'll speak to this here too, the question about whether nurses will be pulled for other work if this gets worse in the state, and the question is, we don't know, and it's going to be very individually based depending on who your employer is. So nurses employed by home health agencies may be different than nurses employed by housing sites, and so checking in with your supervisor about that question is, I think, would be the best thing to do at this point. One other thing to add to the workflow that has come up around the DNRs, things haven't changed at all in the DNR world, but this is a wonderful time to be talking to your participants about their advanced directives, because a lot of folks who are getting very sick with COVID-19 are ending up on ventilators. So if they don't want to be on a ventilator, that needs to be clear in their advanced directives. And so that's certainly something to talk about. But even if somebody has a DNR, if they start to develop symptoms, in most cases, they're still going to go to the emergency room, still going to be evaluated if they're having shortness of breath or are really, really sick. So that workflow has not changed in the state.
Thanks, Casey. I want to talk about some of the questions that have come in. Deb asked about, she said she was informed to hold off on doing any new or reassessments, and asked if that has now changed. Basically, I think that we don't typically do assessments over the phone, so we were trying to figure out how exactly what that guidance would be. And we are understanding if this goes on for a length of time, we may, be working from home for a while. Assessments or reassessments might actually be a really great thing to do with your time, and also a really good way to connect with participants. So what we are saying is that you can't do every part of the assessment over the phone. Obviously, things like mini cogs, vitals, and even like actually doing a med rec are not possible to do unless you're right there with the person. But we are saying that maybe the rest of it can be done. So please be looking out we will be sending out some guidance this week around assessments over the phone. I love Colleen put that you could clean out your files. She deleted contacts out of her phone today who have been deceased for years. So those things that we all need to do and know we should do and just don't have the time to do, now might be a good opportunity to do that. And then questions about where the workflow can be found. So this workflow is not actually on STAR yet. It will be. There is the COVID-19 checklist that's on STAR. So two different things. One is already up on STAR and one is not. Where is the best place to stay up to date on local testing sites and procedures? Casey, you might want to chime in on that, but I would assume that it's the VDH website, or actually, the Minnesota Health Department and the Rhode Island Health Department too. It's like health.mn.gov or health.vt.gov or health.ri.gov. That's where I've been going to get all of the data that I've been sharing about all three states.
This is Casey.
Great question coming in. Sorry, Casey, go ahead.
Sorry, yeah, I am really not sure how to find out about local testing. I have been hearing from partners and looking at your local hospital websites often will be posting that kind of information, but there are also private doctors' offices who are doing some testing for their own patients. So that's the kind of local community work that is going to take a lot of time right now, but certainly reach out to us too if you're having trouble finding that information, and I'll try to see if there is a more centralized way of finding it out.
Great, thank you. We do actually have, I forgot in here, we do have some sort of beginning tips around how to complete an assessment over the phone. So like I mentioned, you can't complete all questions, but you can complete most of the questions. It's a long process, and doing it on the phone, it may actually take several calls, which may not be a bad thing. It might give you a reason to call and check in with people a few times. You can enter the assessment directly into PHL while you're on the phone. Coordinators and wellness nurses can keep completing their own sections as they always have. And, remember that it's only temporary, and our goal is to obviously return to meeting with people in their homes as soon as we are able to. One thing that's coming out new that should be helpful, it'll come out right after today's call, is that Jen has created a COVID-19 risk report. So this is for each panel, and it indicates the participants at higher risk for severe illness, which includes COVID-19, based on the information from the CDC, which can be found at that website. It'll be sent to each panel after this call, and then when you get it, if you have any questions, please let us know. But there was a chat in earlier that said that Kathleen was basing her assessments on two risk scores, either those that are at high risk for contracting COVID or those are at high risk of complication. So this is similar to that, and I think it's a high complication, severe illness risk score. And Jen has an amazing email that explains it all thoroughly. So you'll all be getting this in the mail or in the email after the call. I'm just trying to also check the chats while I talk. There have been a lot of chats coming in. So,
Melissa, can I add one thing to that?
Please do, yeah.
I think an important part of the report Jen did is not just those folks who are at risk of COVID-19, but also those who are at high risk of problems because of the response to COVID-19. So the ones who are very food insecure or already very lonely or very isolated. So they don't necessarily have a high risk of getting the virus or of getting severely ill or dying from the virus, but they may have a high risk of getting hospitalized because of the response to the virus.
Perfect. Thanks, Casey. And a lot of people are chatting in. Thanks, Jen. So it sounds like people are thinking that's going to be pretty helpful. So thank you, Jen. And also Todd chatted in, which I thought was great, that you need an order from the PCP in order to get the COVID test. So when they get the order, they will also get a list of areas where they can get tested. So that will help maybe answer some of that too. I know that doesn't help us answer right now, but for the participant, when they get that test order, they'll be told where they can go locally. We're still working on figuring out in-home testing and if that's even an option. Okay, lots of great talk about doing some assessments in-home and tips and tricks. So I will compile those after the call. One thing that I think is really important to just remember is that our minds are definitely elsewhere right now. We are trying to figure out how to do this thing we've always done one way, kind of a completely different way. And it's a really easy time for HIPAA to sort of get lost in the fold. So I just want to call it out and draw your attention to it. We're doing things a lot differently. We're doing it remotely now in a lot more cases than we were before. So, you know, staying connected and doing so while still being HIPAA compliant are important. Obviously, phone is the best way to do that, followed probably by secure email. Another thing that you can do is, you know, the coordinators and the wellness nurses anyway both have access to CBO numbers. So you could talk about your participants' circumstances using their CBO number. And then some web platforms such as GoToMeeting and Zoom are also HIPAA compliant, but that does typically depend on whether or not you have a business associates agreement with them or not. So you may want to talk to your specific IT department to see if they know of any web platforms that will be HIPAA compliant for you. Then this is just straight out of the privacy officers training this year, just some do's and don'ts reminders so that they can be on the forefront of our mind right now. Store records appropriately. So in this case, I would mean making sure that you have some kind of a locked box or a filing cabinet or even a room that you can lock files in at home. You know, keep up to date on those permissions in whatever way you're able to. Like I said, we'll have more guidance coming out about that this week. Make sure that you're sending protected health information securely. Shred it if you don't need it. And just always kind of think about what if it was my information being discussed. Don't discuss information with your family or friends about your participants. Don't give information to unauthorized people. Try not to leave info on voicemails that is protected health information. And don't leave faxes or copies sitting on faxes or copiers. So again, this is stuff that you all know, but it's just a reminder because it's probably the last thing we're thinking about right now, but it is still important. And then Casey wanted to share with us some symptoms of a fever.
Yeah, this came up because, as you know, it's almost impossible to buy a thermometer right now, and many of our participants don't have a thermometer, and also don't necessarily know how to properly take their own thermometers, their own temperature, so they may not be getting an accurate reading. A fever is considered a temperature over 104 Fahrenheit. Again, they may not be able to take an accurate temperature. They also, people who are older, people who have a compromised immune system because of treatment for cancer or because of medications or just because of age, may not have the same febrile response as other people. So watch for some of these other symptoms as you're talking to folks over the phone. If they're sweating, if they have chills or shivering, headache, muscle aches, loss of appetite, often, especially in older folks, confusion or a change in how they usually behave can be a symptom of a fever. Dehydration is a big one, and so watching for changes in darkening of the urine and general weakness. And I'm going to work on a better handout for participants, or to either share with them or post, or for people to be able to talk to about over the phone. But the next slide is the kind of the CDC guidelines of how to monitor some of the symptoms.
Hey, Casey, just want to clarify, you said 104, but your slide says 100.4. Do you just want to clarify which one that is for the temperature?
Yes, thank you. 100.4 would be considered a fever. Anything over that is considered a fever. I don't know if there were other questions related to this slide.
So we have some people that are asking for this slide to be shared afterwards so they can share it with their participants. So I think, like you said, you're going to put together maybe a simple flyer, and we will post that to STAR, and I will try to include that in the follow-up from this call.
Great. Yes, I can get that together today. Go to the next slide.
And then we had a question. Oh, sure. There we go.
Yeah, and go ahead with the question.
Oh, no, you're okay. Go ahead.
Okay, this is the kind of the guidelines from the CDC, and what I would like to do is just make it a little more specific for our population. So what does it mean to monitor your symptoms, and what does it mean to stay hydrated, that kind of thing. I think the focus on this is very much about prevention, which is great. But you could certainly share this one. At this time, this is available on the CDC website as a free download. And we can also put this one up on STAR.
Great, thank you, Casey. The question I answered in a chat, it was just asking if you can add attachments to secure emails, and yes, you can. Great question, though. And then, so I see a lot of questions coming in asking about maybe a protocol or a policy for what happens when there is a positive case in your building, and I would just say that we are working on that right now. I think Cathedral Square is really close to having theirs confirmed, so we will share that with you all once we know that it's good to go. But basically, we want to make sure that we protect HIPAA, so we aren't sharing the person's name that is positive. Some things to consider are keeping the laundry area clean, and also maybe try to limit the use so there's not more than one person in there at a time. We need to think about providing care for sick participants, who and how. Also those areas that might be close in the community, and then optional signs people could put on their doors: no visitors, please call. Really, I wanted to hear from you all if you have thoughts about what you're going to do. Like I said, Cathedral Square itself is working on some policies in place for when they have a positive case in their building, and we will happily share, but do you guys have anything that you're working on in your sites? And if so, can you share that? If you want to chat in any of your thoughts about that, that would be great. And then we will just kind of compile all of those ideas. Well, the mail room up at the Round Barn is a big problem. I'm assuming that's because it's a place to congregate, Todd. And then this needs to happen ASAP as people are having symptoms and being tested now. Completely agreed. And yeah, Todd said it's a congregate spot. I think that's similar in a lot of our buildings. And then also, a lot of our buildings have places, and it's small, how to communicate to other residents. Yeah, I think that's a really great question, Sarah. And then we're also trying to figure out, is that our place? And I think there's a fine line and a lot of questions around that. Right now, VDH is the one that's reaching out to anyone that may be impacted by a positive case, but is that going to continue? And if not, then, does it fall to us to share? And so it's new ground, and we're trying to figure it out, and we will keep you guys posted as we do. But yes, back to Todd's point, small areas where people generally get together to sit, are going to be a problem. Can we somehow close those off, or can we move furniture? I mean, what are some things that we can do to try to prevent that from happening? Maybe just put up signs everywhere. Kenneth Russell said that we're not allowed to let residents know of positive cases at his building. Okay. Can we ask residents if they have a test done to let us know? There is a precedent. We post bed bugs in the buildings, for example. Okay, so thinking about this in terms of bed bugs, eliminate furniture, put up signs. I'm not sure. I think that, MJ, to your point about can we ask residents if they have a test done to let us know, I think that that's that pre-screening, right? Those 3 questions. Have you tested positive? So before we do any kind of home visit, we should be asking everybody that. Those are those 3 questions that the CDC and VDH are recommending. We have closed community rooms. All building entries have a sign to please not enter if you are sick, and telling residents to have any visitor wash their hands as soon as they enter their home. The property management temporarily shut off cable in community rooms. See, that's a really interesting idea. That would definitely probably stop people from congregating there. I don't think bed bugs are HIPAA protected, so that's a great point. Is that a precedent or is it not? These are all of the questions that we're asking too, and we're working through right now. So we will absolutely keep you posted. So moving us along, social connection alternatives. I think that, as somebody pointed out too, like the social distancing and calling it physical distancing because we don't want to be distanced socially while we are also distanced physically is just such a good point that really, really resonated with me. So what are some ways that we can stay connected? And I just put out some things that I had heard about that I thought maybe you guys might like to hear about for either yourselves or for your participants. Unfortunately, a lot of them require the internet. And so we are still looking to try and find similar things that can be done over the phone. There's one that we're looking into right now. We're thinking about possibly creating some, but we've got our own April SASH coordinator in Burlington who's hosting a mindfulness seminar that you can find by going to facebook.com Cathedral Square, and that'll be live streamed twice a week, I think. April, is that right? You want to maybe chat in the details? Shires Housing is doing phone buddies between their residents. I know many churches are offering call-in options for services. These are just some cool things that I saw. The New England Aquarium in Boston is letting you take live virtual tours. The Cincinnati Zoo, every day at 3, I think, is hosting a new animal, and they're showing live. Like there was a hippo. It was adorable. NASA.gov has opened their entire image library. You can just sit there for days and look through all of the amazing images that they have from the telescope. And then UVM is hosting a free yoga live stream Mondays at 5:30. And I think if this isn't already posted to the SASH calendar, we can put it up there. These are just some ideas that I found about ways that might be able to help people stay socially connected. I love the idea of something somebody mentioned. Sarah Stosselberg mentioned anything on local TV channels. That'd be an amazing idea. So, if you know of anything, if you hear of anything, please let me know and we will share it. You can chat it in now or you can email me. We'll share it with the group on Star. Boredom busters, packets to pick up near mailboxes, crosswords, etc. Jesse, can you send me one? That would be great because there's only so much crocheting that I can do. Ann O'Brien, could there be a bone builders online? That's exactly the kind of stuff that we're thinking about. And also, too, we would love to do some stuff over the phone just so that way if there is someone that doesn't have the internet or a computer, they can still participate. April said today is mindfulness group. April will be providing you with information on how to use all of your senses to stay present in the moment, lead you in some chair yoga, teach a breathing exercise that is soothing to the nervous system, and provide tips on how to start your own home practice. If you can't join the live group from 2 to 3, that's okay because the group will be posted on our Facebook page for you to access later at your convenience. So, between April's 2 to 3 mindfulness and then UVM's yoga at 5:30. I should be feeling pretty good tonight.
Hey, Melissa, do you want to talk to that self-care page on the coronavirus as you're talking about all this?
Actually, if you want to talk about that, Amy, that would be great.
Yeah, sure. So everyone, I started a self-care page for all of us, and you can also share all that with all of your participants. If you go to the shared resources, to the coronavirus, when you go and hover over it, it'll pop out to your right. And there's just a bunch of different things that I've been collecting and started putting down on ways that we can all take care of ourselves in the midst of this, that you can also obviously then, encourage participants to do. And the mindfulness group with April is on there, and I've got a bunch of others, and I'm going to take some of the ones from your screen, Melissa, and also add those on there as well. So everybody is aware. Please feel free to use any of those things. If you have suggestions, you can email me directly, and I'll do my best to add what I can. So thank you.
Awesome. Thanks, Amy. And Ann Eddy shared that Broadway, what does it say here? Sorry. Free Broadway shows for a week. So that's awesome. National Council on Aging has some great resources as well. Jesse pointed out. I wanted to thank you all so much. I wanted to share with you, there's a scam alert, and I know I mentioned last time that there were several scams going around. I actually saw this one myself on Facebook. So it says on Facebook, you'll see it going around. In case anyone needs this, United Way has COVID-19 community economic funds. They will help, blah, 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 blah. But this actually was only applicable, and this isn't even necessarily a scam, but it was only applicable in one area, which I think was like Illinois or Indianapolis. And somehow because like they had posted it just this way without any kind of specification to location, in Indianapolis, it got shared so broadly that 211's been getting hit with a ton of calls trying to figure out how to access this United Way funding. So again, just, try to make sure that you're letting people know there are social media scams and also just untruths and just confusion around. So maybe not to believe everything that they read. And then lastly, I just wanted to point out that, I'm not sure if this is the exact last slide, sorry, but working from home is a balancing act, and I think we're all kind of living it right now. Casey shared this picture and said that it doesn't quite look this fun at her house. I know that my house doesn't quite look that fun yet either, but anything that you could share about ways that you're successfully sort of melding the two, working from home, and then all of the kids are on break, and partners and friends and family are all also working from home too. So I know that I actually had to go this weekend and just carve out a separate space in my house where like this is work and the rest is home. Any tips and tricks that you guys have for that, I'd be happy to compile as well and share. We can just all kind of learn from each other as we go. And I also did just put the yoga live stream thing down here as well because it went with the picture. And then lastly, I just wanted to end with the quote that I heard this week. It was by a superintendent, and honestly, I don't know who the person was. They didn't say. But in the end, it will be impossible to know if we overreacted or did too much, but it will be quite apparent if we underreacted and did too little. So I just think that it's been helpful to me to remember that as we've gone through this past week. And I think about it often, actually. So any information that you can share that we can work on this together would be great. We will be doing this again next week, same bet channel, same bet time. So next Monday at noon. And if you can use that COVID-19 chat group with your questions, I will try to gather up all of the chats that have come in from today, if there were any that we didn't get to, and get some answers to you. That would be great. Melissa Stockholm shared that Phil Scott's having a press conference today at 1 p.m., so we'll be sure to listen to that. Yeah, I think that's everything, guys. Thank you so much, and we will talk to you next week. Take care. Bye-bye.